Never give up hope. We must accept finite disappointment but never lose infinite hope. By Dr. Martin Luther King Jr. Professor Stephen Hawking was visiting Delhi to deliver a talk. There was a lot of excitement in Devang's school about the visit. As we were watching the news, we began discussing Professor Hawking's life. Devang and I spent a couple of hours on the web learning about his amazing life. In 1963, when he was 21, Stephen Hawking was diagnosed with a serious neurological disease called amyotrophic lateral sclerosis (ALS) and was told he had only a few years to live. ALS is a progressive neurodegenerative disease that affects neurons. It affects 350,000 people a year globally. In ALS, voluntary muscles action progressively get effective, day-to-day activities become difficult, and the individual may be totally paralyzed. Although Hawking became wheelchair bound, he went on to Cambridge to become a brilliant researcher at Guy's College. From 1979 to 2009, he held the post of Lusacian Professor at Cambridge, the chair held by Isaac Newton in 1663. A Fellow of the Royal Society and a member of the US National Academy of Science, he is regarded as one of the most brilliant theoretical physicists since Einstein. ALS created many difficulties that Hawking considered challenges that needed to be overcome. Technology, immense willpower, and hope helped him conquer these challenges. Special computers designed in California allow him to communicate using only two fingers as he has no motor control over his body and is unable to speak any longer. His body has been incapacitated by ALS, but his mind is still working hard, trying to unravel the mystery of how the universe was created. Hawking had once said, I'm not afraid of death, but I'm in no hurry to die. I have so much I want to do first. He's a man who never gave up and never will. Augusto and Michaela Adone were living in the beautiful Comoros Islands when their 5-year-old son, Lorenzo, started to experience behavioral problems. While initially the doctors felt that this might be due to difficulty in adjusting into a foreign environment, Lorenzo's difficulties increased over time. He started to have memory lapses. His eyesight began to fail and he started to have unexplained falls. When he was 6, a diagnosis of adrenonucleocatastrophe (ALD) was confirmed. ALD is a rare genetic disorder that is X-linked and hence primarily occurs in males. It is usually seen in children between the ages of 4 and 10. The child's condition deteriorates, sometimes rapidly. Behavior problems worsen, coordination becomes impaired, deafness and memory loss are common, swallowing becomes difficult, vision deteriorates, and total disability can ensue within a year. This disorder is fatal. The Oden family consulted the best ALD expert, Dr. Hugo Moser, in Baltimore. As there was no specific therapy, Lorenzo joined a clinical trial for a special diet. The diet did not help. Augusto and Michaela Adone were not ready to accept that Lorenzo was going to die. They could have given up, most parents would have, but they did not. They started reading about ALD and spent numerous hours at a medical library going through all the published research. They organized the first ever conference on ALD to bring together all global experts working on the disease. They started to hypothesize on what caused ALD and which therapies might work. In 2 years, the Odons arrived at the hypothesis that the combination of two cooking oils could inhibit the enzyme that overproduced the very long chain fatty acids. They started administering this oil to Lorenzo through a feeding tube. Lorenzo's fatty acid levels decreased, and Augusto published his findings. On the basis of these findings, Dr. Moser felt encouraged to commence all his young ALD patients on this oil. A family from the UK, the Staffords, flew to the US and started their son Barry on the oil. The Staffords discovered that the younger son, Glenn, who was only 2 and had no symptoms, also had the defective gene. Dr. Moser decided to put Glenn on the oil even though he had no symptoms. Over the years, however, it became clear that Lorenzo's oil could not stop progression in ALD. Barry Stafford and other children died. While Lorenzo remained alive, his condition did not get better. Dr. Moser decided not to give up. He started prescribing Lorenzo's oil to boys who had the gene but no symptoms. His trial showed dramatic results. 10 years after starting the boys on Lorenzo's oil, 70% did not develop symptoms, while Lorenzo could not be saved and died at the age of 30. Many lives have been saved since. Glenn Stafford, the first boy with no symptoms to be put on the oil, remains well more than 2 decades later. Today, the outcomes for ALD are dramatically different. Boys with the defective gene can be identified, and Lorenzo's oil can give them a real chance of not developing symptoms of this deadly disease. This happened thanks to Augusto Odone, Nicola Odone, Dr. Moser, and the Stafford family's positive spirit. As a doctor, I am amazed by the cases that make us reconsider the limits of the human body and the definition of the word impossible. One such case I always marvel at is that of Jody Miller, a happy and mischievous toddler. At the age of 3, Jody started having seizures and was prescribed with an antiepileptic medicine. The seizures kept on increasing in frequency and severity, and there were days when she had 100 seizures in 24 hours. More antiepileptic medicines were added, but the combination of medicines could not control the seizures. Jodie's condition worsened. She developed partial paralysis and could not walk. Jodie's parents were told that she suffered Rasmussen's encephalitis (RE). RE is a rare inflammatory brain disease with a terrifying outlook. It occurs in 1 in 500,000 to 1 million individuals, affecting only one hemisphere side of the brain. RE mostly occurs in previously normal children. It typically affects children between the age of 2 and 10 years. Symptoms are restless seizures and a rapid decline in cognitive learning ability, along with increasing weakness of one side of the body as the disease progresses. The progression takes place over 1 to 2 years. Although the precise mechanisms are still uncertain, RE is considered as an autoimmune disease. The child's own immune system cells enter the brain and cause inflammation and damage. The possible trigger could be a viral infection. The inflammation causes permanent brain damage and shrinkage, worsened by the seizures themselves. Since the seizures continually increase, the only treatment is radical surgery. Radical, perhaps, is describing it mildly. The surgery involves removing half the brain. Yes, half the brain. A radical hemispherectomy is what this procedure is called. When Jodie's parents were told that the only treatment option was a radical hemispherectomy, they were devastated. Any parent would be. Imagine being told as a parent that the only effective treatment is removing half your child's brain, not 10, 20, or 30%, but 50%. What can be more extreme in terms of treatment? We know that each part of the brain controls specific body functions like speech, vision, and hearing. Some of these areas that control important functions are as small as a few centimeters. When removing small areas can produce significant effects on normal body functions, what would be the consequences of removing half the brain? The Miller family understood that as this disease affects only one of the hemispheres, removing that hemisphere would make the seizures go away. But what would happen to all the body functions controlled by that side of the brain? This was the biggest concern that Jolly's parents had. Would she be able to use her limbs? Be able to speak, read, and write? Go back to school? Go back to her happy self before Ari afflicted her? The family chose to go to Dr. Ben Carson, the renowned pediatric neurosurgeon who had also visited our hospital to give expert advice. Dr. Carson explained that the rationale that disconnection of the half of the brain would make the seizures go away. After the removal of the hemisphere, fluid will fill the empty space that would be created. A child's brain has more neuroplasty, allowing neurons from the remaining hemisphere to take over the tasks from the lost hemisphere. So, in a way, the brain has the ability to rewire itself. Although the arm and hand functions on the opposite side get impaired, children adjust to using the healthy limbs. Even when the language hemisphere is removed, reasonable language skills can be regained. Children do not forget what they had learned earlier. The younger the child is at the time of surgery, the better is the adaptation. He mentioned that the surgery could take up to 12 hours, but rehabilitation could take weeks to months. Dr. Carson gave them the confidence that Jolly would get better. Jolly's family made the most difficult decision and agreed to the surgery because this was their only hope. The hemispherectomy went on smoothly, but the post operative period was trying. Jolly underwent prolonged rehabilitation and eventually regained her strength. The seizures stopped, and her body learned to function with half her brain. Slowly but surely, she recovered. Jolly eventually went back to school. At 8, she topped second grade. She completely completed her university degree. Now Jolly wants to be a teacher. Her mother, Lynn, is now Specialty Director (RE) at the Hemispherectomy Foundation, helping families dealing with RE. There cannot perhaps be a better advocate than Lynn. She knows what it takes to look after a child with RE, the difficulties in dealing with this condition, the strength needed to go ahead with the radical surgery, and the patience to see one's child make slow progress post surgery, one step at a time, one function at a time. Above all, she knows how to tell them to never give up hope. Freya used to have 200 seizures in a day. She underwent hemispherectomy surgery in Melbourne in 2010 and is now seizure free. Cameron Mott underwent this surgery at the age of 9 and now, 6 years later, wants to be a ballerina. 7-year-old Gemma Hockley, a right hander, had her left hemisphere removed. 4 years later, she was playing her favorite sports, soccer and basketball. At school, Gemma was recognized for neat handwriting, an extraordinary achievement considering now she writes left-handed. Hundreds of children have benefited from this surgery. Imagine not just functioning but excellent with only half of your brain. When children with RE who need to lose half their brain to get better and their families do not lose hope, how can any of us? Over the last 2 decades, Dr. Carson has involved his surgical tips. While earlier he used to remove the whole hemisphere at once, now he takes out piecemeal. This results in less pull on the remaining half of the brain with better outcomes. We all want to do so much. Quite often we try and then give up. There are justifiable reasons to give up, or at least reasons that we think are justified. Whenever I hear about people giving up, I tend to tell them that the positive spirit that I see in families of children with serious illnesses, for them, each day is a struggle. Imagine the trauma of painful tests and injections, the repeated hospitalizations, the side effects of therapy, and the risk of opportunistic infections. Despite the uncertainty of the final outcome, families bravely face the challenges. Doctors are so fortunate that each time they feel like giving up, the families of patients they care for inspire them not to. When I find circumstances challenging, all I have to do is spend extra time with children who are admitted in the hospital. My challenges seem trivial in comparison. Teachers and parents need to reconsider visits to a hospital for reality check on what real difficulties in life. A brief interaction can change one's perspective towards challenges that seem insurmountable. When Devang talks about difficulties in his life, all I have to do is remind him about what he has. There is no medicine like hope, no incentive so great, and no tonic as powerful as expectation of something tomorrow. By Orson Swett Marden.